Hi, everyone. Welcome to our webinar today. I'm Kristen Alexander from R0. I'm our Chief Marketing Officer, and I'm joined today by Adi Sarosa, who is Senior Consultant for Forrester's Total Economic Impact Practice. And we're here today to talk about the projected total economic impact of R0 from a study that Forrester has conducted. So what I thought we would do is we'd start off by going through a very quick overview of R0 and why our technology is important to the market and how we're helping people across industries with also a climate benefit. And then I'm going to turn it over to Adi, who's going to spend the majority of this webinar talking about Forrester's report. Just to recap, issues with indoor air health have gone unchecked for too long. And in fact, this became an issue that we all are acutely aware of as a result of the pandemic. People started to question, well, what is the quality of the air that I breathe? And what is the health of the indoor environments where I spend most of my time? We, in fact, spend 90% of our time inside, and the best parts of life happen there. We spend time with our family, with our coworkers, with our friends. It's critically important that students and teachers and educational staff are in environments where they're set up to achieve. And we are extremely invested in keeping our frontline workers safe and in environments where infection risk is lowered. We want to keep our economy thriving and allow everyone to operate safely where we live, work, and play. There's really been a tipping point in the industry this year where two governing bodies, ASHRAE, which is known for setting the standards of the nation's building codes, as well as the CDC, have come out with guidelines and recommendations for the number of air changes per hour that happen indoors. ASHRAE has set forth a standard called 241 that makes recommendations based on the industry that you're in, whether it's a school building or a hospital building or an office as an example, and the types of activities that happen in different rooms, how many air changes per hour there should be to maintain a healthy environment. And the CDC, which protects the nation's public health, has come out with a blanket recommendation that every indoor room should have at least 5 air changes per hour. And because of these two organizations setting guidelines and recommendations, it's really causing the industry to take notice and start to take action on how to provide healthy indoor environments. This, of course, is meaningful because if you have an effective disinfection program where you are creating a healthy indoor environment, you're able to not only provide the benefit to your employees, to your staff, to students, anyone who is operating in your environment, but also there are financial benefits and outcomes to you as well. So effectiveness, decrease infection risk, with using UVC, which is our technology as part of a disinfection platform, you're actually taking the most sustainable approach in the market from energy usage and the decrease in chemical byproducts. And you can do all of this at a very affordable price, which we'll get into a little bit later in the presentation. What we offer at R0 is the only IoT-enabled disinfection platform, which means that we're able to understand all of the parameters and characteristics of your indoor health, make an assessment of risk where you have activities and environments that are higher risk spaces and lower risk spaces, give you a sense of that risk in real time, and then make recommendations for how to mitigate and remediate that risk using UVC as a technology. And we offer a number of different UVC types of devices and technologies purpose-built for the specific use case. For example, we have our ARC device, which is a mobile disinfection tower that you can move around a building as part of a regular janitorial workflow or for incident response. And we also have installed devices which operate autonomously, continuously to disinfect air and sometimes surfaces in real time as people are spending time together. So all of this approach to the market, saves money, is sustainable, and offers other benefits to your organization specific to the type of vertical you're in. And Adi's going to spend time walking through those verticals and explaining the benefits from Forrester's study. With that, I'm going to tee it up to Adi.
Thank you, Kristen. Hi, everyone. Very happy and honored to be here. So as Kristen mentioned, my name is Adi Sarosa, and I am a senior consultant here at Forrester's Total Economic Impact Practice, or TEI. At TEI, what we do is we work with technology companies of all shapes and sizes to develop business cases that quantify the costs and the benefits that customers experience from their technology investment. So in this webinar, I'll give an overview of the TEI process and walk you through the results of the study that was commissioned by R0. So before we review the results of the study, just a quick disclosure. This study was commissioned by R0. Forrester does not endorse R0 nor its products. Forrester is an independent third party with editorial rights on the study. And we developed this study with the data collected from the customers of R0 that were interviewed. So when analyzing someone's investment in a specific technology, traditionally most organizations conduct what is usually called a TCO, or total cost of ownership, which articulate the value of only cost and cost savings. Others might do an ROI, or return on investment study, that incorporate the business impact of technology investments, including the benefit. The TEI takes us a few steps further by incorporating a couple other components. So you can see here, the TEI consists of 4 components, which includes the benefit, which is the added revenue, the business benefits that an organization experience from their investment, the costs, which essentially are the upfront and ongoing costs of adopting a technology. And then we also evaluate what we call flexibility, which here at Forrester we define as what helps to incorporate the strategic value of future investment enabled by this original investment. And then for the 4th component being risk, where across all the 3 variables I just mentioned, we adjust for the riskiness and uncertainty of an investment. In this particular project, what we did is what is called a new tech TEI, which has the same overall structure of the TEI that I elaborated, but instead of looking at the benefit based on historical use case, we model projected benefits based on the experience of a user that were interviewed in a pilot, maybe proof of concept, and any other early implementation experience of the solution. So in this methodology, we do a scenario-based approach where certain variables are presented as a range, which then results in potential outcomes that an organization may realize. To complete this analysis, we took a multi-step approach, which includes conducting a full due diligence in understanding what R0 offers as a solution, the marketing positioning of it, the value proposition that it offers to its users. We then interviewed a number of R0 early implementers of the solution to understand the projected benefit and costs they hope to realize from their investment. We then merge the interviewees together and create a composite organization, which is a fictional hypothetical organization based on the interviewees' characteristics. And then we created a financial model based on that composite organization to quantify the impact of an R0 investment to this composite organization, and closed by writing out the analysis in a case study at the end. So the interviewees in this study shared a number of challenges and pain points with their previous environment, which drove their interest in investing in a solution like R0. At a high level, the key challenges that were shared with us include the lack of awareness on indoor air quality issues, concerns about the efficacy of their existing cleaning and disinfectant process, and operational inefficiencies of prior efforts. As Kristen alluded to previously in her section, the pandemic particularly brought the issue of indoor air quality from somewhat of a niche topic to something of a key metric that people now want to know about. Interviewees shared their concern that their current cleaning and disinfection process of spraying and wiping just wasn't comprehensive enough, and so they looked for something that could complement, if not improve, their efforts. So for this study, we interviewed 6 representatives from organizations using R0, As you can see here on the slide, the interviewees that we spoke with came from a wide range of variety in terms of roles, industry, region, the size of organization, and their R0 footprint. The results of our study are based off what we call a composite organization, which is, like I mentioned, a representative organization built from an aggregation of data points from the R0 users that we interviewed, creating a hypothetical organization with specific characteristics that drive the quantification of projected value we were able to calculate for this study.
Adi, can I
Yes,
just ask you a question? Would
of
you be
course.
able to just talk through the different industries where you interviewed customers so people have a general sense?
Yeah, definitely. So in general, the six customers that we interviewed came from four industries or four verticals. We interviewed customers in the healthcare space, healthcare and hospital systems, senior care facilities, educations and school districts, and general corporate offices who were using R0, as I will explain later, in a return to office renormalizing in-person meeting type of situations. So based on that composite organization, we modeled the projected benefits that the organization will receive from their R0 investment. Again, since we did a scenario-based approach for each of the benefit, our projection shows a range of outcome based on specific factors. But at a high level, the projected benefit quantified here are value from being able to quickly set up and scale the R0 footprint at your organization, the impact that R0 has in complementing existing disinfectant processes, making it more operationally efficient, and the cost benefit realized when compared to alternative solutions that these organizations were considering. The combination of the three quantified benefits generated the following results in terms of projected return on investment or ROI and projected total benefits. As we will dig in when I speak about each individual benefit, the low end of the range represents the low case scenario, whereas the other end representing the high end scenario and the mid case scenario falling somewhere in between. The quote included in this slide here captures a key value that interviewees see from their R0 investment, noting that R0 allows them to reach areas that their traditional spraying and wiping effort might have missed, ensuring a more comprehensive cleaning result. As a result from the more comprehensive cleaning, interviewees shared the impact that an investment in R0 has on just the overall well-being and general sense of safety for their employees. So let's now dig into each individual benefit. The first benefit is the time savings realized due to the faster setup and overall scalability of R0. And an interviewee in the education space here shared that they were able to deploy 400 units of R0 tools equipment in 3 weeks, which was not something that other vendors they considered were able to guarantee. Consider that this statement was given to Forrester in the midst of the pandemic when time was of the essence and schools and colleges needed to quickly find a way to ensure the safety and the cleanliness of their classroom. In our model, we projected 65 to 75% time savings with R0 compared to using other vendors, resulting in a $23,000 to $27,000 in financial impact. The key factors that differentiate the range here include what exact R0 product was being implemented, the alternate vendor R0 was being compared against, and the skill set and availability of the implementing staff. The second benefit relates to the increased operational efficiency in the room disinfectant process. Using R0 did not mean completely discontinuing the previous effort by custodial staff, but interviewees noted that by having R0, the custodial service did not have to spend as much time spraying and wiping. We calculated this to be a 50 to 83% acceleration in the disinfection process, which translates to a $626,000 to $1 million over 3 years in projected value. The differentiating factor in this benefit are the significance of a comprehensive cleaning effort where organizations like a hospital or senior care that specifically measure and try to avoid metrics like hospital acquired infection or HAIs will likely keep the custodial service at the same level with R0 complementing it, whereas an office space having R0 would see it as significantly reducing the custodial effort of spraying and wiping. Finally, the interviewees shared that R0 is cheaper compared to the other alternative solutions that they were considering, which translates to cost-saving benefit here. As you can see on the slide, interviewees shared with us the significant cost saving that they were able to realize by going with R0. And we calculated that to be a projection of anywhere between 200 to 400% in cost savings over 3 years, translating to a potential financial impact of anywhere between $746,000 up all the way to $2.2 million. And more than just the sticker price, what interviewees told us was that R0 came with certain capabilities. I think Kristen mentioned in her section, the reporting, analytics features that came with R0. And these interviewees told us that these features were something that other technologies, other vendors at similar price point just wasn't able to offer.
Adi, I wanted to ask you a question. Since the time that actually this customer quoted their price, we've worked really hard to drive down the cost of the components of our devices. And the reason why we focus so acutely on this is because we want to democratize access to UVC as the best-in-class disinfection platform for all industries, really. And so we're focused on making it as affordable as possible to provide healthy indoor environments everywhere. And so since this time, we brought down our cost by so that it is only 1/3 of this cost or even less. And it really depends on how you purchase in the purchase plan, whether you're buying up front or distributing your payment over time. My question for you is, since we brought down the cost of our platform dramatically, does that impact the financial impact here?
Yes, definitely. So you are correct. This quote and the calculation that is modeled in this study is based on the experience of the interviewees at the time that we interviewed them. So if situations change, contexts change, you are able to offer lower pricing points, then it is fair to assume that the impact, the value that they realize for this particular benefit can be significantly more than what is projected in the study.
Thank you.
Yeah. In addition to the 3 quantified benefits, there were also other impactful benefits that the interviewees shared, but unfortunately were not able to quantify. Which includes brand improvement and potential impact on top line growth. So interviewees told us that investing in R0 tells other stakeholders, prospect, customer, that their organization particularly care about indoor air quality. So an interviewee in a senior care facility told us that, by investing in R0, that has an impact on how others see their organization, which can lead to more referrals, more prospective residents, which has direct impact to their top line growth as a business. Another interviewee from the corporate office space even connected this investment in R0 to something like an insurance premium, telling us that they could potentially get lower figures on their insurance premium by showing insurance providers that they use R0 technology to reduce risk of their environment. The second qualitative benefit is new opportunities related to the mobility of R0. So interviewees shared that it was very easy to move R0 technologies from one place to another. For some, this is a simple coverage expansion benefit, but for a hospital network, for example, this could be translated into new opportunities, new product, new service offerings. The interviewee in the healthcare space told us something like being able to introduce mobile clinics, ambulatory surgical centers, because R0 products being light and more efficient to be moved around. And then lastly, the reporting and data integration features. I alluded to this earlier. in the context of R0 bringing capabilities that other technologies at similar price point just wasn't able to offer. So interviewees highlighted that R0's ability to generate report that can be shared with key stakeholders as a differentiating feature when compared to other alternative solutions that they considered. An interviewee noted that if an infection event happens, they can easily track it down to see if they use the tool, they can analyze trends, etc. We also bucketed industry-specific benefits for R0 in this study, highlighting the use case and value for organizations in the 4 verticals that I mentioned: healthcare, senior care, education, and corporate offices. For healthcare, the focus is to ensure the highest level of cleanliness and disinfection. So they really valued that R0 is scientifically proven to reduce all airborne and surface-borne pathogens, viruses, bacteria. For senior care, R0 supports the business model of needing to position themselves well relative to their partners in hospital networks that can provide them with patients, with potential residents. So the value of R0 here is around the efficacy of the tool and how it impacts their brand. For education organizations, the thought process is directly related to teacher and student absenteeism, which affects their budget, which affects their operational costs. So having a tool, a technology that can minimize these absenteeism is clearly seen as something very valuable. And then finally, for corporate offices, within the context of the pandemic and having employees working remotely, they use R0 to re-normalize in-person contact, interaction in office spaces. The value of R0 really comes through when it eases employees' concern about being in close space with others back in the office, which correlates to their satisfaction and has some correlation with their overall employee productivity. Since we calculated projected ROI in this study, also included in our write-up is an in-depth discussion of costs. So at a high level, we identified and quantified 3 cost components for the composite organization based on the conversations with the interviewees. So which are the costs to the vendor or to R0, the time investment related to initial planning, initial setup, implementation, and then once it's set up, any time investment by their internal staff related to support and ongoing management.
And just to clarify here on the cost, what I thought would be helpful to share is that our customers pay for our platform based on their preference. So some customers prefer to pay upfront, and they include the devices and the ongoing management, which is essentially our software subscription. And some customers prefer to spread that out over a 3-year or 5-year term. The ongoing management is for collecting data and then analyzing that data so you constantly have a pulse on your indoor health, risk, your ability to remediate incidents as they come up, and also adherence to janitorial workflow. So all of those insights are part of the annual subscription, which again, some customers pay for upfront and some customers pay for over time.
Great. So again, I'll close with showing everyone the financial summary with the range of projected ROI, projected NPV that we were able to calculate over 3 years. As I mentioned, the new tech TEI methodology is a scenario-based approach where we have a low case, medium case, and high case result. This is why all the projected results are in ranges. You can see the reasoning behind these ranges, including what needs to happen for one to be in the low, medium versus high case in the full case study. So again, if you are interested, I would highly recommend that you give the full study a read. But hopefully that gave you a taste on key insights that you can find from the TEI study. If you are interested in learning more behind the actual math and dig deeper into some of our assumption, the full study does go into all that detail along with the discussion of our methodology. So I highly encourage you to download and read the report if you are interested in what we discussed today. So with that, I want to thank everyone for their attention, and I'll pass it back to Kristen.
Thank you so much, Adi. We appreciate that. I think just one question to clarify. When you talk about the composite buyer, how do you put the composite buyer together? Like, what's your criteria to determine what the composite buyer would be?
Yeah, so we think about the composite buyer, like I said, it's an aggregation of the key characteristics of the different interviewees that we spoke with. So we think about what were the benefit categories, the value that these interviewees were able to tell us. And based on that quantification, what assumptions we need to put into the model. And to come up with that assumption, we looked into what was the exact experience of the 6 interviewees, right? So if, for example, we need to assume the number of staff that a custodial staff that an organization is, that the composite organization needs to have for us to calculate the improvement in operational efficiency of their disinfection process. Then we will look into what was the experience of the education, the school district, the hospital network, the corporate office that we interviewed, and then come up with a reasonable assumption of, for this composite organization, what is the reasonable assumption for that custodial service. So the idea is to have a composite organization, a composite buyer that readers like everyone here in the audience would be able to relate to. They can attach their experience with the composite organization, and if their experience is different, they know what metric in the financial model they need to adjust to have a more accurate calculation for their experience.
Great. And then as readers are going through the report and maybe they're looking at what's specific to their industry and comparing to the composite buyer, should they have questions, are they able to reach out to Forrester, or how do you provide detail further if someone had a further question about the study?
Yeah, definitely. So I included here. Oh, actually, I did not include here. But I can definitely pass my email contact information. So it's just my first initial A Sarosa at Forrester.com. You can also reach out to R0, who hosts the study, and they can connect you with me, with Forrester, and as a larger organization, if there are any questions about the methodology, about TEI in general, or about anything about how we came up with the value in this study.
Excellent. And certainly I'm available to take questions too. My email is kristen.alexander@r0.com. I think we'll throw it in the chat, and we just put your email in the chat as well. So should people have specific questions, they can reach out. We really appreciate you walking us through this report and explaining the methodology and the impact across these verticals. It's great to be in this time where we are at a tipping point in the industry, and it's become, as I think you referred to it, as a metric that organizations are now tracking. So thank you so much for spending time with us today.
Thank you.